Welcome back, Focus Learners. Today, we're diving into another explainer, and we are unraveling a really fascinating anatomical puzzle, one that actually begins long before a person is even born. We're talking about Klippel-Feil syndrome. We're going to look at how a single microscopic error in early development triggers this massive biomechanical domino effect that echoes throughout the entire human body. So if you're prepping for exams or you just want to master the structural logic of congenital anomalies, you are in the exact right place. Let's get into it. Here's our roadmap for today. First, we'll cover the classic ChemiFS triad. Then we'll look at the wasp waist sign. Third, the system-wide domino effects. Fourth, dangerous neurological complications. And finally, mastering the differential diagnoses. This structure is perfectly designed for your exam prep and grabbing those high-yield Viva points. All right, part 1, the classic KFS triad. Let's kick things off by looking at this condition from the outside, starting with what's immediately apparent to the naked eye. At its core, Klippel-Feil syndrome is all about the congenital fusion of cervical vertebrae. When those neck bones are locked together, you get the classic KFS triad. First up, a noticeably short neck, which makes total sense, right? The fused vertebrae just physically reduce the overall length. Second, you'll see a low posterior hairline. And third, severely restricted neck movement. Patients will have a profound loss in rotation as well as flexion and extension. The mechanics literally just aren't there to allow the neck to turn or bend normally.
But here is a massive clinical pitfall that you absolutely need to commit to memory right now. Fewer than 50% of patients actually present with this complete classical triad. That is a huge Viva point. The absence of the triad does not exclude KFS. You simply cannot rely on visual inspection alone.
Moving right along to part 2, the wasp waist sign. Since those external signs can be so totally unreliable, we have to look deeper. And to understand the imaging, we really need to understand the embryology first. Normally, cervical somites, you can think of them as the precursor building blocks of the spine, they separate neatly during early development in the womb. But in KFS, there is a failure of segmentation. It's like a tiny developmental glitch. Instead of separating, the vertebrae fuse congenitally. Most often, this failure locks together the C2 and C3 segments, or the C5 and C6 segments.
Now, what's really cool is how that developmental failure actually shows up on an X-ray or a CT scan. It creates what we call the wasp waist sign. This is your hallmark imaging feature. When you check out a fused segment in KFS, you're going to see this characteristic waist-like anterior concavity. It literally mimics the pinched, narrow waist of a wasp. And why does this matter? Well, because this specific smooth concavity strongly suggests a primary congenital fusion, rather than a secondary acquired fusion from something like trauma or disease later in life. Because we're dealing with a fundamental structural issue, it almost never happens in isolation. There are some major associated skeletal anomalies you need to know. Scoliosis is incredibly common, often driven by hemivertebrae or block vertebrae that throw off the spinal curve. You might also spot rib anomalies, like fused ribs or extracervical ribs. But listen up, the absolute highest yield fact to anchor for your exams is Springle's deformity. This is the most common associated anomaly in KFS. It's a congenital elevated scapula. Basically, the shoulder blade sits much higher than normal simply because it failed to descend properly during embryogenesis. Just to round out this skeletal picture, here's a great extra point for your notes: the KFS classification system. It categorizes the severity of these block vertebrae. Type 1 is a massive cervical fusion across many segments. Type 2 is much more localized, usually just fusion of 1 or 2 vertebrae. And Type 3 is the most extensive, featuring cervical fusion combined with fusion further down the spine, in the thoracic or lumbar regions.
Let's move into part 3, system-wide domino effects. Let's see how this all builds. We're going to expand outward to look at how this seemingly localized spinal issue links up to broader systemic problems. Because Klippel-Feil syndrome is definitely not just an orthopedic issue. Since that segmentation failure happens so early in the womb, it triggers a system-wide embryological domino effect. Keep this checklist in mind for your vivas. For renal anomalies, watch out for renal agenesis or an ectopic kidney. Those are the most common. Cardiac anomalies are also a major threat here. Think ventricular septal defects, coarctation, and other congenital heart diseases. You can also see craniofacial issues like a cleft palate or facial asymmetry, and really importantly, hearing loss due to related ear anomalies.
Which brings us to part 4, dangerous neurological complications.
Okay, so we've looked at the skeleton and the organs. But now, let's zoom back into the spine. Based on everything we've just covered about fused bones and altered mechanics, what do you think is the single most dangerous complication of Klippel syndrome? Take a second to think about it. The answer? Cervical cord compression. This is an absolute must-know fact. If you take away only one single thing from this explainer today, let it be this.
The crucial thing here is understanding why this happens. The fused block vertebra itself, it's rigid, it's stable. The actual threat doesn't come from the fusion directly. It comes from the devastating mechanical stress that the fusion forces onto the healthy, mobile joints immediately above and below it. Those adjacent segments have to massively overcompensate just to allow any neck movement at all. Over time, this extreme hypermobility leads to severe cervical instability, which eventually causes cord compression and myelopathy. Basically, the healthy joints are literally destroyed by doing the work of the fused ones.
And this is exactly why getting an MRI is absolutely essential. An X-ray or CT will show you that bony wasp waist, sure, but you need an MRI to hunt down these severe soft tissue and neurological complications. You're looking for direct visualization of cord compression, signs of disc disease at those adjacent hypermobile levels, syringiobohuia, and any associated Chiari malformations.
All right, final section, part 5, mastering the differential diagnoses. Being able to distinguish KFS from conditions that mimic it is the true hallmark of a master diagnostician. The classic comparison you'll see is Klippel syndrome versus ankylosing spondylitis. Now, on imaging, both feature a fused cervical spine, but their origins are totally different. KSS is a congenital defect featuring that smooth, pinched wasp waist we talked about. Ankylosing spondylitis, on the other hand, is an acquired, inflammatory condition. It doesn't have a wasp waist. Instead, it features a bamboo spine caused by syndesmophytes bridging the vertebrae, usually along with associated sacroiliitis.
There are a few other mimics you should definitely keep on your radar. Surgical spinal fusion can look similar, but you can usually resolve that by checking the patient's history, looking for surgical scars, and spotting hardware on the imaging. Juvenile rheumatoid arthritis can also cause cervical instability in fusion, but remember, that's driven by chronic inflammation. Fibrodysplasia ossificans progressiva is a super rare disorder causing progressive soft tissue ossification, so the fusion there is secondary, not a primary segmentation defect. And finally, multiple synostosis syndrome is a genetic issue affecting multiple joints progressively over time. The key takeaway? None of these share the fundamental congenital segmentation failure of KFS.
To tie this all together, if you're ever asked to summarize this condition in a professional setting, here is the absolute perfect one-line radiology answer to deliver. Congenital fusion of cervical vertebrae with associated block vertebra formation and wasp waist deformity, suggestive of Klippel syndrome. It's perfect. It captures the anatomy, the mechanics, and the hallmark imaging sign in one go. It really makes you marvel at the sheer complexity of human development, doesn't it? Because if a single microscopic failure of segmentation in the womb can cascade into a lifetime of biomechanical and systemic domino effects, what other hidden embryological chain reactions are just waiting for us to uncover them? Keep studying, keep asking those big questions, and I'll see you in the next explainer.